So we have Juhi with us. Juhi, correct?
Yes.
Okay, so Juhi will be extracting your wisdom tooth.
Yes.
So I hope you are feeling okay with it and you allow us to start the procedure. ऐसा लग रहा है आपको देखिए कि आप बहुत डरे हुए हो.
हाँ, डर तो होता है.
नहीं तो आप प्लीज डरे ना. आप यू बी वेरी कंफर्टेबल, यू आर इन वेरी सेफ हैंड्स. लेट्स बिगिन द प्रोसीजर. So this is the wisdom tooth which we have to take out, the decayed one you see right behind in the jaw, and it is covered by bone and gums. So to take it out we need to cut that bone and the gums covering the tooth. Unlike other normal teeth where we directly take them out, here we have to expose the tooth first. We have to remove the gums over it, and also we have to cut the bone which is surrounding the tooth so that we can take it out. So this is the incision we make in the gums and the cheek tissue, and with this incision we expose the bone. So now we will be seeing the bone which is covering the tooth. So this is how the gums or the cheek from inside which was covering the tooth has been removed, and now we see clearly the bone which is covering the tooth, which we have to cut and remove. So this is how, with the help of a machine, we cut the bone which is covering the tooth. So you see here that the bone on the buccal side, means the bone which is on towards the cheek side, is being cut with the help of a rotating machine which we call as micromotor and handpiece device. That is cutting the bone, and now after we cut the bone, then we can make the tooth free from that socket with this instrument, and now we can remove the tooth out after it is mobile or after it is moving. So now the tooth is moving, it is free from the socket. So now we can take the tooth out. So this is how we are just taking the tooth out smoothly from the socket, and it is very important to check that the tooth is not broken. It is completely out in a single piece. And now we are irrigating and flushing the socket so that we remove all the infectious material from there, and we also remove all the bone particles which are there because of our cutting. So we clean the socket nicely. So this is how you see the socket is clean. It is completely empty from where the tooth was taken out. So after this you again need to close the socket with the help of a few stitches. So say 3-4 stitches are there, small stitches, which will cover up the socket, and with the help of these stitches the gums will be in perfect shape as you want them to be, and they'll heal up very fast. So within 7 days you will see that these gums are completely healed and there is no gap as such left behind there. So this is how you place the stitches and you close the socket. Socket means the empty space now from where the tooth was taken out. It's called as socket. So we need to close it again. So these are the stitches. So I hope everything was good और आप comfortable थे.
Yes, बहुत ही. मुझे थोड़ा सा भी पेन नहीं हुआ, बिल्कुल भी नहीं हुआ. बहुत अच्छा लगा मुझे.
Okay, very nice.